pressing concern, personally. Yes. And you see, the chair was prodding me to say my other title. I didn't want to say it. But now I have to say it. The SG of ODM, a party that has committed that when we take power, there will be free healthcare. And the people of Homabay will not be paying anything at level 4 hospitals. That will take away 70% of your revenue. That's the concern we are raising. Secondly, Governor, address these landing fees. If in my head I get it correctly, are these beach landing fees for fishermen?
This is beach landing.
Yeah. So it is a bit odd that a county that is known for fishing and its beaches is making less from landing fees than veterinary services.
Yeah, thank you, Chairman. Let me answer the question on healthcare by saying that even the monies that we are raising currently from health, they are not out of pocket expenditure. They are insurance. They are from payments from SHA. They are payments from insurance. Mostly, actually, 95% is payment by insurance to the facilities. So it's not out of pocket. So even when we get to universal health coverage, like we're doing at the moment, these monies continue to come because people don't pay out of pocket, but they're paid, the insurance pays the facilities. NHIF pays, but SHA pays even more now for facilities because the registration is higher. In terms of fish landing, Mr. Chairman, you are a fisherman yourself, and you know that it has been very, very difficult to harness a revenue stream like fish landing, because people have been landing over the years for free. So these are streams that we are introducing, and we are working day and night with our beach management units to try and get them to help us to get these fish landing fees. So fish cess and fish landing are streams that have been nearly non-existent, but they are streams that we are harnessing slowly. But you know that with the protests that we had, it has been very, very difficult to introduce, taxes that did not exist well, because people are very, very jittery about paying new monies. But we are discussing constantly. Even when you look at the fish cess, it is some of the things that were very, very low, but we are growing them, and we are growing them slowly. But we have them as streams because we want to grow them. But you can't grow them alone. You can't be at the beaches and everywhere. You have to grow them in partnership with the beach management units. Those processes sometimes do take time. But Chairman, the point I was making is that overall...
Maybe before you lose it, because as you have said, I'm a fisherman. This committee would not be the one to advocate that you put some tax for boats to land on beaches that existed even before Kenya became Kenya. Yeah. But your receiver of revenue should have pointed you to a stream called beach service fee, which fetched 10.9 million, where there was a growth from 7 to 10.9. So I think the BMUs underassess. So the BMUs are paying something. Let the message not go out that the Senate is asking for enforcement of landing fees for boats. That will be, there'll be an uprising.
Chair, first of all,
protect indigenous communities.
The governor,
Chairman, is more political protection as opposed to.
Chair, I think the governor has, well, in a way, outed you. Now we know that you're a fisherman. That you have interest to protect when it comes to landing fee. But I think the bigger question, Governor, is, Governor, yes. I think the bigger question is, does it concern you and your government that 70% of your own source revenue comes from a single stream? You know, that should concern anyone. Whether or not that means you introduce fees in landing and whatever you're going to do, it must concern anyone that 70% of an entire county's own source revenue comes from one revenue stream.
And are we that sick?
That's the problem.
Chair, on health, so that she can combine both. Apart from being concerned, you have said it's mostly not out of pocket, but you are getting, Chair, I think 3 days ago or for last week, we were with the ICT committee in Machakos, and they had a pending bill of 500 million from SHA. So what is the success rate? Because as under the arrangement, the Wananchi are not supposed to be charged on outpatient. So you have made comparison between the NHIF and SHA. So how can you paint the picture on how this revenue will grow? Because if you are saying it is more significant after the reimburses from NHIF, there will be a great improvement through the social health authority. So can you paint that? And you know, Chair, we saw, and you know, we are judicially noticed that there were some of your facilities that they were being accused that they do not exist, but they receive remittances from SHA, and I think it became a national concern. So maybe put into us that perspective in terms of reimbursement from the social health authority. But on the issue of whether they are sick, I think you should tell us whether is the facilities within Homabay serving only Homabay residents, or some of your neighbors from Kisumu and Kisii have immigrated, and therefore that is where you are getting more resources.
Okay, Governor.
Thank you, Chairman. Chairman, I think I just wanted to state that the growth in revenue within health is become as a result of tightening a lot of things within the sector, the health sector, and also putting our eyes as a government on the health sector revenues and making sure that we have no leakages there, and that the facilities are facilitated to be able to make their claims and do everything. And we're also registering. We moved our registrations, for example, from 6% to 19% when we were still in NHIF, and now to 49% when we have moved to SHA. So that has been the push. Are we concerned that 70% of our revenue is from health? Yes. We want to diversify our revenue streams. So we have been working, for example, on our land revenues, digitizing of our land records and linking it up to the revenue system. And that also I would like to answer Senator Cherargei, who asked, do we have a digital system? Do we have all our streams onboarded on the digital system? Yes, we have most of our streams onboarded onto the digital system. Land was one of the later ones, but land in the last couple of months, we have also been able to now link up land. So one of the streams that we are putting all our eyes on in this coming financial year, is the land rates revenues, because these are revenues that are there, and if you go after the owners of the land, then they can be able to pay both the arrears that they hold and also the current revenues. That can be able to push. We have pushed a lot our single business permits. As you saw, we have had quite a bit of growth from about 64 to 101 million within one financial year. That's no mean feat. Remembering that Homabay is a rural village county, most of the towns are in the rural areas. To get SBPs to that extent also took a lot of work, digitization, digital invoicing, so that people are able to pay up for the invoices. I wanted to respond to the question of SHA and the facilities that were said not to have existed, and I think it is very clear that in naming of places, many areas have the same name, and in this case, we had a facility that we are yet to open in Nyandiwa in Kasipul constituency. It is a dispensary. And then we have Nyandiwa Level 4 Hospital, which is in Suba South, which is a facility that has been in existence since the 70s. So apart from the political spin that the issue got, these are two distinct facilities. And recently we received the Health Committee of the National Assembly that came and saw both the facility in Kasipul and the facility in Nyandiwa, and the kind of work that the facility in Nyandiwa has done, even with their FIF, they were very, very impressed at the improvements that have taken place in the real Nyandiwa. But I think there was a political spin to it. I just wanted to make that clear since Senator Cherargei raised it. So the question of are we that sick does not really arise. I think people get sick and go to facilities, but the reason for increase of revenue is very, very deliberate. Very, very deliberate in terms of getting our revenue collection and administration in order. And Chairman, there was a question you asked earlier about how do we project. And I wanted the chairman of the Revenue Board, who's also a long-standing, retired from KRA after serving there for over 30 years, to maybe just make a short response of how do we project our revenue and how did we result in an over-projection that fell short.
Okay, before that interjection, let's hear from the Vice Chair and Senator Sifuna.
Yeah, thank you, Chair. I'm looking at note 12, and I got interested on this revenue stream on conservancy administration, which increased from 1.2 million to 12 million in 2023-2024. And when I look at page 11 of the statements, that conservancy administration, the major increment was as a result of liquor licensing. That is on page 11, up there, which increased from 350,500 to 10.9 million. What was happening before, Governor? Does it mean that there were no licenses or liquor licensing in 2022-2023? So much so that maybe because of a law or just enforcement, we got this increment from 350 to 10.9 million, just for my curiosity, Chair.
Okay. Senator Sifuna.
Yeah, Chair, first of all, Governor, the SHA itself and the Ministry of Health has admitted that there were ghost facilities that were actually receiving payments. So it is not very fair to say that it was just about politics. The government itself has admitted that there were facilities that were getting payments from SHA that do not exist. There was also a list of facilities that was put out, that was banned. And one of the things the ministry explained is that people are registering names of facilities that are so close to each other. That is how they are facilitating the fraud. So the suspicion of Kenyans really was to seek answers, not to say that it was about politics. But I wanted to understand, ordinarily, just for the perspective of people who are not fishermen, like the chair, how much do you charge for these so-called landing fees? Because I want to understand something, Chair. How much is it?
Okay, as the Governor responds, I think on the efficiencies or inefficiencies of SHA, the person who should be sitting there is Aden Duale. Unless, Governor, you want to defend Duale's issues, just deal with your issues in Homabay. To avoid a very broad conversation that will take us to an area where you do not have subject matter expertise. I think what Senator Sifuna said is a fact, and it is not only happening in Homabay, it's happening across the country. I think for SHA, let's go back to how your numbers will look like with the introduction of SHA. I think that's an important thing for us to understand from Homabay.
Chair, you made me forget one other thing. In the disclosures themselves, if you look at note number 8, which covers the hospital fees, Governor, you have attributed the bulk of the money from, in terms of the income for the facilities, to payments from insurance and SHA. Now, you have only disclosed level 4 hospitals. Are you saying these are the only hospitals that are paid by SHA in the county? Do you have any other levels of hospitals? And where is the revenue from those?
And I think what we have seen in that kind of disclosure is that you indicate whatever rebates came from NHIF, whatever rebates came from Linda Mama when it used to be there, and whatever was collected from facilities. In this case, you have not provided that breakdown. So it's very difficult to establish the facts around what you had said. Could you deal with the liquor licensing? I know this committee has processed that matter in the past, but just put it on record. But help us understand, now that SHA has been introduced, because people think that there'll be no payment at the hospital, but then there are certain rebates that are coming. Will those rebates come back to the 800 million that you have been collecting previously. And then we'll allow the chair of your board to tell us about the budgeting process.
Thank you, Chairman. In terms of liquor license, you remember, Chairman, our first meeting in KICC, one of the things we were put to task on is whether we had mapped our facilities and whether we were, ready to push an improvement in that particular revenue stream. And we assured you that by the September of that year, we were going to have fully mapped our liquor facilities, and that was going to result in an improvement. So we mapped all our facilities, and we also mapped them to the system. So we have been able to push increase in liquor licensing by mapping all the liquor facilities, and also through the support by the Revenue Board and the reviews, the monthly reviews of what revenues we are receiving. That is what has resulted in that push. And that push is not just in liquor alone. If you look at the revenue streams, you will see that majority of them, just by leadership, monitoring, and efficient revenue management system and digitization, you're able to see much more revenues. Chair, we are not where we want to be in terms of revenue. We have room for improvement, and a lot of it. And we are daily working on that room for improvement. We are daily improving our revenue, and when we come back for 2024-25, you will see that a lot of the streams, again, we have moved further than where we were. In terms of the question of the levels of facilities that are receiving money, in 2023-24, we were on NHIF mostly, and NHIF was mostly giving money to level 4 facilities, with exception of Linda Mama, which was being given to facilities, lower level facilities that were charging. Now, with the SHA, now you have the reimbursement of the primary health care fund that is going to lower level facilities, and that's why we are saying lower level facilities are not expecting any money from the public. That is level 2 and 3, because they are getting the primary health care fund directly from SHA. So moving forward, Chairman, we have seen 2024-25, the revenues have actually gone higher. What has happened is out-of-pocket has reduced. And why has out-of-pocket reduced? It has been because of and I'm not speaking about for SHA generally. And the reason I also responded to the issue of Nyandiwa was I was responding to the specific Homabay question. And even the politics I was referring to was specific Homabay politics, not necessarily national politics in that sense. So what we have seen in 2024-25 is an increase. Why? Because and a reduction of out-of-pocket expenditure, but an increase in the amount of reimbursement. This is because SHA has removed the waiting period. The 2 months that you had to wait, the 60 days that you had to wait in NHIF. So if I arrive at a facility and I need to, spend 10,000, but my SHA for the whole year is 6,000, I will pay SHA for 6,000 and then I will receive treatment. So this has seen more people paying in the SHA, and therefore the amount of money that the hospitals are receiving in reimbursement has grown. And the amount of money people are spending on out-of-pocket has reduced. Not for any reason, just because people can pay immediately and get services. The viability of that, or the question of its sustainability and so on, I think that's what you said is a different question, and is a question to be answered by a different person.